Case study, child abuse as a social issue. Barriers to protection can include families slipping through the gap, blanket agency approaches instead of individualised family approaches, a lack of agency, accountability or buck passing, socioeconomic factors. Families that are experiencing lower socioeconomic factors have a higher incidence of interaction with child protection services, a history of family and domestic violence and trauma. Alcohol or substance misuse from parents can add to protection concerns. Parents that are difficult to engage or fail to attend, coupled with a lack of resources and support for parents, can add to barriers to protection. A lack of cultural consideration from agencies, limited parental capacity, poor parental mental health, and disorganised attachment with the parent and child. For the case study family, falling through the gap is something that has occurred with this family. The lack of agency accountability with two different agencies involved in the placement of these children. Socioeconomic factors, mum is reliant on men who are violent to her to be able to afford her life. Alcohol misuse, two children with suspected fetal alcohol syndrome, difficult to engage parent, a lack of resources, a history of trauma with the family and domestic violence, limited parental capacity. Mum seems overwhelmed with 5 children, 2 of which have neurological disorders, poor parental mental health, and disorganised attachment. General barriers to participation can include the system being overwhelming to navigate without help from support agencies, gender inequality for mothers who are being held accountable for protecting their children from family and domestic violence, but no accountability for the perpetrators, previous unsuccessful engagement with services, overwhelming parenting demands, a lack of service depending on the need and or the location of the family, lack of suitable and accessible resources for families, a lack of knowledge, this may be how parents were raised, a lack of community engagement, families may not know where to seek help if they want to seek help, and the stigma surrounding accessing services. The barriers specific to the case study include long-standing neglect, lack of agency collaboration, so again, 2 different agencies involved in the placement of these children, lack of trust of agencies from the parent, gendered inequality, family and domestic violence from the mother. She's being held accountable for not keeping the children safe from the domestic violence. A lack of parental capacity, again, 5 children, 2 of which with neurological disorders would be overwhelming. A lack of knowledge. Mum may not know how to help keep these children safe. Disorganised attachment we see with the 14-year-old not wanting to be with mum. Strategies for protection for the 14-year-old. Under the United Nations Conventions of the Right of the Child, children have a right to be protected from harm, neglect and abuse. Children also have a right to be heard about matters that impact them. Allowing the 14-year-old child input into what their future may look like can create long-lasting positive impact into adulthood. Consider a change from foster care to kin care to promote protection with greater outcomes from kin care for well-being and placement stability, along with the benefit of connection to family. Provision of supportive, trauma-informed continuous case management, including advocacy coalition building to enable better outcomes and balance biases and differing values of multiple support agencies. Increase access to universal services to better support the child. Provision of pathways to support for the kin carers to build caregiving capacity to mitigate future risks to the child while building family functioning. Aim to reduce child power imbalance. A family focus approach working with both the child and the parent to support restoration if appropriate. Disorganised attachment repair. This type of attachment is linked to children who have experienced abuse and neglect. This could be done through the attendance of parenting programs for the mother. And a strengths-based approach to build resilience in the young person. Strategies for participation for the 14-year-old child can include supporting the child's right to agency through their voice, can lead to positive outcomes in well-being, resiliency, and increased sense of advocacy. So allowing the child to be heard on what is important to them and what their future would look like. Acknowledgement of lived experience for the child and trauma-informed case management, and working collaboratively with other agencies as well to provide that wraparound support for this child. A use of strengths-based approaches to build upon the child's existing skills with a focus on goal setting for the child, including permanency planning. Getting the child involved in what their future looks like can be empowering for the child. Responsive case management for the child, which builds rapport to mitigate the adult-child power imbalances. Being able to think on your feet as a child protection service worker and being able to respond appropriately as the needs of the child change. A family-focused practice to support the entire family unit with a view to restoration if appropriate. This obviously relies on building parental capacity and repairing the disorganised attachment with the child and parent as well. A list of resources used for this presentation.